I've come from a background where after my youth service in Nigeria, I worked in environmental health and I realized that there were loads of other social determinants to health. The concept of health was not purely about medical thing, and that influenced my decision to study a master's in public health. I looked at England because the public health models here were research oriented. So basically that influenced my decision to come to England. Wolverhampton, I chose Wolverhampton because their research looks at health in the context of inequalities, and that's a very, very big issue driving healthcare in Africa. And so that's why I chose the University of Wolverhampton as well. First impression was can this really be England? Because Wolverhampton is a multicultural city. This multicultural mix it wasn't what I was expecting when I came here, but it was a pleasant surprise anyways. What I've gained here is how to think for myself, how to think for myself basically. I've just become more independent in my thought process, and I've got that confidence to think of things and then follow these things up through. So I'm more disciplined. I'm a little bit confident than I used to be, and I've got bigger dreams than I came in here with. So on the whole, yeah, I'm better off than I was when I did come in here. The Masters in Public Health was structured along the lines of having lectures every week, but the lectures were not your traditional lectures, so you didn't just come into class and hear the tutor preaching to you. It was more like going into class and then listening for a bit and then going back home to do your assessments and then do your own study. However, the courses were structured in such a way that we had professionals coming in to give us those lectures. So we didn't have the lecturers coming in there. Say you're taking a module in public health, in health promotions, I beg your pardon. What they did on the course is to get somebody who is working in the field of health promotions, like a proper executive in an NGO, and then they come in and tell us how the concepts were being taught in class is applied in their everyday work setting. So I think that's another big difference that doing the course in Wolverhampton offers you. The construction of the class reflected the construction of the university. It was a multicultural class as well. So we didn't just have white students, we had black students, we had Asian students, we had Caribbean students, we had students from the Middle East, and this reflected in the discussions we had in classes. Sometimes we think about health, we think about interventions, we forget about people's culture, their traditions, and how this also influence health. And the multicultural nature of the construction of that class enabled us see how people's culture and attitudes towards religion and beliefs could influence their ability to take up health services. Right now I'm a research assistant with the Center for Health and Social Care Improvement, and basically I work in research, in health research. What we do is we try to improve health by researching issues around inequalities, issues around medical interventions, issues around stigma, issues around domestic violence. Any issue that has a health aspect to it, we research that and ensure that our outcomes influence practices. Basically, all the skills that I developed on that MPH course are the skills that enabled me secure the job, and are the same skills that enabling me perform on the job as well.